step forward, please.
Okay. Ready. All right. All right. Good afternoon, everyone. I'm Josh Jabal, Chief Operating Officer for the state of Connecticut. 1 week ago tonight, Governor Lamont was at Danbury Hospital, where we had our first encounter with COVID-19 here in the state of Connecticut. And based on the guidance of our experts in our public health department, based on the learnings of other countries and other states that have gotten into this pandemic sooner than we have, the governor directed us with strong bipartisan support from our legislative leadership to take swift action on the steps that we can take as a state to slow down the spread of COVID-19, to protect our most endangered citizens, and to give our outstanding healthcare system and our great hospitals and healthcare workers and doctors the best chance to help us through this pandemic. I am going to, in a minute, review some additional actions that we are announcing today to help our communities and businesses adjust to the new reality that we're now facing. But before I do that, I'm going to turn to our state Chief Epidemiologist, Dr. Matthew Carter, with the Department of Public Health, to give us an update on cases.
Hi, good afternoon. My name is Dr. Matthew Carter. I'm with the Connecticut Department of Public Health. Since yesterday's update, we have confirmed 5 additional, actually the number is now 6 additional people in Connecticut who have tested positive for COVID-19, bringing the total number of confirmed positive cases reported in Connecticut to 11. The 6 new cases are residents of Bethlehem, Darien, Greenwich, and Westport. To date, 136 tests have been completed in Connecticut, 11 positive tests, and 125 negative. For the first time, we are reporting data now that includes data from the state laboratory as well as from private laboratories, which have performed 21 tests. For those of you who just for clarification about the numbers, yesterday we included in our case count a resident of New York. In the United States, cases are counted by their state of residence. So we have removed that person, and we are now including a Connecticut resident who was recently diagnosed in the state of Utah. And so that is a resident of Greenwich. You may not have noticed last night the Centers for Disease Control and Prevention changed their travel alerts, and there is now a global level 2 travel alert, which includes the United States. So all of the United States is now considered to be to have a level 2 travel alert for COVID-19. At this point, I'm going to turn this back to the next update.
Thank you, Dr. Carter. I'd now like to review several steps that the administration is taking to help essential services continue, so that we can continue to work, buy groceries, feed our families, and work through this challenging time, and support the social distancing measures that are important for all of our citizens, and in particular for our state employees. First, meals for students attending schools that are closed due to COVID-19. We all know that schools provide so much more than just an education. For many of our low-income families, schools provide essential nutrition and 2 meals a day. Today we're announcing steps to continue this vital service, as we have now well over half of the school children in the state not going to be in school starting on Monday. Children enrolled in schools that have closed due to COVID-19 who depend on the federal school lunch and breakfast program will continue to have access to those meals throughout the duration of this period. With the permission of the State Department of Education, school districts and community organizations approved to administer a summer meals program last year may serve students effective immediately. Currently, schools must distribute meals from a non-school site, and students must consume the meals at that site. We've petitioned the USDA, Food and Nutrition Services, to waive those requirements, and with the support of our federal delegation and Congresswoman DeLauro, that's been approved. With this approval, closed schools will be able to work with State Department of Education to allow multiple meals at a time to be picked up from those distribution sites, including from schools. So that's a very important action that will be help our major cities in particular. Second, The PURA, Public Utility Regulatory Authority, has issued a cease and desist directive to all electric utilities, preventing shutoffs for customers while they are under a public health emergency. So people having a challenge making ends meet during this period of time will not have to worry about losing heat or power. And we'd like to thank Attorney General William Tong for petitioning PURA that has resulted in orders that gas, electric, and water public services that it regulates implement a shutoff moratorium as well. Moving to Department of Labor, Commissioner Westby is here with us today. Department of Labor is suspending the federal RISIA work search program effective immediately. This should protect the public and our Department of Labor employees. This program involves a more intensive process that mandates recipients of unemployment go to the American Job Centers in person and receive one-on-one help. Suspending this program will reduce the traffic in the centers and help limit in-person contact with the public. DOL is preparing an update on the availability of unemployment insurance as well. In the case of a furloughed employee who's returning to work, we're exercising power granted by the federal and state government to suspend work search requirements for unemployment benefits. We'll also be promoting the pre-existing availability of unemployment to furloughed people who may not be aware it's an option. So all measures designed to help support people who are either furloughed or out of work, as well as to promote social distancing in our state offices. Fourth, turning to our Department of Social Services, and Commissioner Gifford is here with us today. The state DSS is implementing changes in Husky and Medicaid Medicaid and our Husky Health Program that will support Connecticut's COVID-19 preparedness and response through increased access to health services. Specifically, for 850,000 enrolled residents, DSS is going to cover identified telemedicine services effective today. At this time, telemedicine coverage includes real-time video conferencing, as can be enabled with a smartphone between Husky Health members and their healthcare providers for specific medical and behavioral health services. This will enable many members and doctors to communicate remotely with Medicaid during a virtual visit. And we're also broadening video conferencing in general to include all primary care type evaluation and management services for medical and behavioral health. And DSS is working with our federal partners on additional measures that we hope to announce soon. Turning now to support for small businesses. As the governor mentioned here yesterday, we're now officially announcing that DECD is making some changes to our Small Business Express program and portfolio of loans to enable the approximately 800 outstanding loans with an aggregate loan balance of about $110 million to have a deferral period of 3 months. This represents about $5 million in loan payments that will be deferred. There's no additional interest or penalties associated with this deferral, just the whole payment schedule essentially slides to the right by 3 months. And we believe that this will provide meaningful benefit to those 800 mostly small businesses in this country. And Commissioner Lehman, in collaboration with a number of other commissioners in the legislature, is working on a broader package of supports for both individuals and businesses to get through this challenging period of time, and he'll be at one of these press conferences likely early next week to discuss that in more detail. Also, the Department of Energy and Environmental Protection, we're announcing that we are closing visitor centers and facilities at some of our state parks that are open to the public and receive significant visitor traffic throughout the day. Examples include the Visitor Center at Dinosaur State Park and the Meigs Point Nature Center at Hammonasset, and those closures are effective immediately. These actions are all designed to help our state agencies support the people of Connecticut and also our state employee safety, which we hold paramount. We are working on a number of additional similar actions across all of our other agencies, and we expect to be announcing those over the weekend. And with that, we are all here to take your questions.
Josh, the president had said that there were a number of things that the state should put in place, emergency procedures. Are they already done here? Where does the state stand on the things he was just talking about in the previous? Yeah,
we're still digesting some of the content from that. I mean, I think that you're referring to the elements of preparedness actions. So I think you mentioned, you directed states to set up their emergency operations center and to activate their preparedness plan. We completed those actions in the middle of January. So we've been working on this for a long time. There's nothing new there for us. What we were interested to hear, and we were talking about as we were listening, is some of the discussion around additional testing capacity, private sector partnerships. Depending on when that comes online, that could be incredibly impactful. So we're eager to hear more details about when that could come.
Testing, Dr. Carter, I wonder if you could answer this one, because we're getting a lot of questions about these drive-throughs that require a written order from a physician. How do you get that? And the doctor doesn't want you to come in. And if the written order is prepared, how does the doctor get it to the person who needs to go to the drive-through?
The patient actually has an old-fashioned piece of paper that's an order in their car, and they hand it to the doctor who's doing the swab.
No, but how does the patient get the written order from the physician if they can't go to the office?
Well, we know many people are being, handed these pieces of paper that are orders, and I assume that's how it's happening. If there are,
People drive to their doctor's office and ask them to come out and send.
I can't tell you that's exactly how it's happened, but I talked to somebody a few hours ago who did that very same thing. Remember, you have to have a doctor's order in order to have a test done.
So correct me if I'm wrong. You would call your doctor's office. Usually you don't get the doctor. You get a voicemail for a physician's assistant. You tell them your symptoms. They call you back. They ask you some more questions. And then they say, okay, we're going to give you a written order. Come down here and pick it up out front.
Correct. That would be, that's how it's been described to me. We now have 3 hospitals that have set these up, Greenwich Hospital, Bristol Hospital, and Waterbury Hospital. As you know, Greenwich has been open for a few days, and Bristol and Waterbury Hospital started today. Yes.
What's the status of Yale New Haven? You said they'd be up pretty quick.
Yale New Haven Hospital Laboratory is the one that I'm hoping will come on board. I know that they are still looking at sites, so is Hartford Healthcare. They're still in the process, but those 3 hospitals are up and running.
Josh, can you talk about what's happening with the nursing homes? There's greater restrictions now on nursing homes in that they are not even allowing conservators and attorneys to visit their clients in nursing homes.
Yeah, in the executive order that the governor issued that we announced yesterday, that was relaxed to enable conservators and probate activity. The commissioner of the Department of Public Health is going to be issuing revised guidance on that topic shortly. But independent of that, I know that this is a very difficult issue for people who have family members in nursing homes. But I think it's important to remind everyone that if you do have a loved one in a nursing home, or in a hospital for that matter, or any high-risk person who is in the state of Connecticut, the way you can best show your love for that person right now is actually to keep your distance, to enable them to see as few visitors as possible, knowing that they are high risk, and that's the best approach for everyone to take independent of the guidance.
This seems, though, I mean, you relaxed them yesterday in the executive order, but this seems to be a stepping up now of a restriction of a constitutional right to an attorney. So when is the?
It should be coming out very soon, hopefully later today.
Later today.
Josh, I had a question for you.
Can you address some of the education, that Monday, half of all school children will be out of school. And it was brought to my attention today that with this distant learning, that not all schools are eligible for that. Certain school districts, I understand, will get a certain amount of free meals and may not have Wi-Fi in their home. Therefore, they can have some schools doing distant learning and other schools don't, because that would be unfair. So are many schools really for the next 2 weeks there won't be distant learning?
So 30% of our districts have closed schools for Monday, which is about 56% of our students. So there's supplemental learning that is being offered for districts, and that's something that our agency has worked with different providers, and just this morning we provided feedback and guidance to districts on what they can use. So all districts have access to that. What you're referring to is distance learning, where they're counting those experiences as school sessions. Districts have to apply for a waiver for that, and we're reviewing that carefully before we allow for that to serve. And they have to make sure that equity is being considered, meaning that if they don't have Wi-Fi access at home, materials are going to be developed and picked up by parents.
Dr. Carter, could you please get into a little further about our ability to test at this point?
Testing this week is much more available than it was last week. We expect that to continue. I think our focus for the next 2 weeks is to bring, as a plan, we have Yale New Haven Hospital Lab coming on board. We have 3 of these test sites at acute care hospitals that are separate from the main hospital, the Greenwich and Bristol and Waterbury hospitals. We know we have additional ones that will be coming online next week. These sites are using commercial laboratories for tests. Right now, I think the biggest issue with testing is getting the sample taken, which goes to your comment as well. It's because many doctors' offices are reluctant to have somebody come into the office and get a throat swab done because they don't have enough personal protection that's routinely used. And we can't send them to the emergency departments because they're full up right now seeing people. So it's really a question of accelerating these sites for testing. For those of you who just heard the press conference, the president, they're in discussions with CVS and Walmart and Walgreens to have these kind of alternate testing sites set up at those commercial establishments. This could dramatically increase, with drive-throughs. But I don't think we're going to be able to see it. My guess is that's not going to be there for another couple of weeks.
Could Commissioner Westby speak to the unemployment issues that Dr. Rollins outlined for us?
Okay. Did I answer your question?
I'd like to follow up on that.
Oh, I'm sorry.
Yeah.
Can you run us through how the Bethlehem, Darien, Greenwich, and Westport people were confirmed with Dr. Medicare?
We have, this is in the press release, I believe, but we also are getting positives from commercial laboratories as well.
And were you aware that there were issues in New London today with some testing? Have you encountered any issues with samples or testing at this point?
I'm not sure if we're talking about the same thing, but I was going to talk about the fact that we were made aware this afternoon. Well, actually, it was earlier this morning. The Rhode Island Department of Health reached out to us to tell us that a Rhode Island child who has tested positive for COVID-19 and attends a daycare in Mystic. So right now, that's already been, I believe we've already seen media attention in that part of the state about this. Fortunately, that facility is now closed, and we're working with the local health department to do contact investigations and making sure that everyone who was in contact with that child is going to be staying at home for 14 days. I don't have any further details on it at this point because
Someone had contacted us, I'm sure you must be getting a lot, but someone was saying something about those computer issues they got with testing in New London.
I'm not familiar with that, but I think this is important news that I wanted to share with you because so far the eastern part of our state has been relatively untouched.
Is the new Bethlehem positive related to the previous Bethlehem?
There is family transmission going on.
Do you have any information other than Westport, where there was a large party and there were any number of people who are symptomatic at this point? Are there similar situations around the state you've identified?
Well, I'm not aware of the situation that you're describing. So, as we've said, we're encouraging people not to have large gatherings.
This is the result. This was a party a week ago. Somebody who left the country and then told these people they've tested positive, I believe, in Europe. There has been someone in Westport now tested positive, and these kids from Quest, they're trying to test as many of these people as possible. But
I'm not familiar with that situation.
Dr. Carter, do you have a sense of what the testing capacity will be, say, early next week as these other labs get up and running?
Well, right now the testing capacity is not limited by the number of tests that are available. It's the places where we can get people sampled.
Right, but so as you increase the number of places, do you have a sense of how many people will be able to test?
Well, these larger labs are high capacity. They can do a lot more than our laboratory can. These large commercial laboratories can literally test 1,000 specimens a week. So that's what our hope. The big news on the press conference, the president's press conference, was that Roche has developed a quick test, a relative, that could be used for this purpose. And this was rapidly approved, and they're going to be rolling this out. And this could be a really important advance in getting rapid results back.
Is it your understanding that Walgreens, Target, CVS, and others may be doing similar things in Connecticut where the president mentioned that they were
yeah.
doing that on a national scale?
Well, as was previously mentioned, we need to see the details. There was a lot of really positive news during that press conference, and it was very encouraging. But we need to see, how fast things are going to happen. It will be the key piece for us.
Is there any sense of how long this is going to go on for kids who are out of school right now? Should they plan, most of the schools are closed that I've seen for about 2 weeks. Should parents be planning for a longer term than that?
Okay. There's never been a coronavirus pandemic before. So we don't know for sure. Many of us are assuming the closest thing that we have are influenza pandemics. And we had one. Yeah. And if we compare this to, we don't know how close that comparison can be. But influenza pandemics, usually the majority of cases occur in a 6 to 8 week period of time. And there are 3 waves in 2009 and early 2010, 1918, 1957, 1968. There was waves at different times of the year. So I'm expecting to see a fall wave at least that might last just as long, and perhaps a spring wave in 2021.
So what sort of signs should districts and local health departments be looking for when they're deciding whether to reopen schools?
Well, I think what we've discussed together is that we're going to need to we're evaluating this every day and make a decision before 2 weeks is up as to whether or not that needs to be extended.
Josh, can you tell us if the new cases, how many of them were community spread, how many were travel related? Because in response to Mark's question about the New Bethlehem case, you said it was, there is family transmission, but you didn't say that
So Greenwich was diagnosed in Utah?
Yes,
He or she was visiting Utah?
correct.
Josh, excuse me. Can I get an
Yes.
exact question?
I actually don't have that information for you for this group of tests, but I do not believe that any of these are related to international travel. Most of these new cases are related to family transmission.
Is that related to travel to New Rochelle or Westchester County?
I don't know if that is related in this particular case. New Rochelle has been a big issue so far.
So the Greenwich, there's the one man that was in Utah. Is he currently, or she currently still in Utah at this time?
That's our understanding.
And then, so there was another person from Greenwich as well?
Yes,
So
there.
that is completely unrelated to
Correct.
that man
Yes.
or a woman? Can you tell us?
Yes, yes, I'll be happy to. Hold on a second. So there are 2 Bethlehem cases. One is a woman, aged between 30 and 40. There's also a man aged between 60 and 70 from Bethlehem. There's a woman from Westport whose age is 40 to 50. A man from Darien whose age is 50 to 60. A man aged 40 to 50 from Greenwich, and a man from Greenwich between the ages of 20 and 30. The last one is the person who's in Utah.
Josh, you had mentioned earlier CURA affording protections to utility customers facing shutoffs. Does the state have any authority to protect renters who might be facing eviction or be struggling to pay their rent at this time?
Yeah, I'm not sure. We can get back to you on that.
You were talking about telemedicine for Medicaid people. Is the insurance department negotiating with insurers to cover it for regular policyholders?
Good afternoon, Deidre Gifford from the Department of Social Services. Many commercial insurers already cover telemedicine to a certain extent. So in many ways, Husky is aligning with coverage options that were already available in the commercial market.
And would you consider continuing to cover it past this? Is there a deadline for coverage of this?
So what we announced today are two types of coverage. One is coverage, telehealth coverage for behavioral health and certain medical visits. That will be permanent. That will be a permanent change to Husky. The other set of services that we announced are general medical services for Husky members. We're at the moment calling that a temporary change, and we'll be reevaluating as this situation evolves as to whether that will continue after the conclusion of the COVID episode.
Are you getting any guidance in terms of any kind of expansion of SNAP, or what are you hearing about that? I can imagine there might be some families in a situation where they might need some assistance with meals and putting food on the table.
Yes. So we are working with the USDA, the Food and Nutrition Services, to obtain whatever waivers are available for SNAP. And we should have information back from them in the coming days about whether or not those waivers are accepted. In addition to that, we have convened a public and private partnership around food to be working with the private sector providers, food banks, et cetera, to identify where there might be gaps and how we can assist in providing food to individuals who need it.
What should people who do not have a primary care physician do? Does anyone have an answer? Because there are, there's people like that.
Federally qualified health center.
So
They go to the emergency rooms, that's what they do.
Right. So a couple of things that I would offer. First of all, there are a number of nurse lines that have become available. We are sharing those through the COVID website. The 211 is for people who do not have clinical questions. But if you have clinical questions and you call 211, you will be referred to one of these nurse lines. So I know Yale New Haven has set one up, Hartford has set one up. We have one for Husky. So Husky members can look on the back of their white card. There's a phone number there that they can call. Press number 3 for the nurse, and they will be connected 24 hours a day, 7 days a week, to a nurse who can answer their questions about this issue. In addition to that, I would say I'd like to remind the public that you can apply for Husky benefits any time of the year. There is no open enrollment period for Husky, so if you are uninsured, you can go to accesshealthct.com and apply for benefits. You may be eligible for Husky, and you can get information back, usually within a day, as to whether you are eligible for Husky or not. If you don't have insurance, you're not eligible for Husky, and you need to be seen, there are federally qualified health centers that will see individuals either for free or on a sliding fee scale. We're also working through the emergency command to stand up a list of urgent care centers where individuals can seek care if they don't have a regular source of primary care provider.
Getting information about this pandemic to the homeless population.
You want me to take that? Yeah. So we have also stood up under the Unified Command working group that's being led by Commissioner Mascaro-Bruno from the Department of Housing, who is working with the Connecticut Coalition to End Homelessness and all of the shelter providers to do training and to make plans for individuals who might be affected by this and how they will be cared for.
Dr. Carter, the Class 2 designation for all of the United States, is that just cautious for people in risk groups not to travel, or what does that mean?
Well, I'm quoting from the CDC website. It says, there is sustained community spread of COVID-19 in the USA. Older adults and travelers with underlying health issues should avoid situations that put them at increased risk for more severe disease. This entails avoiding crowded places and non-essential travel.
Dr. Carter, for Bethlehem, you said the two most recent, that is a family transmission. There's now a total of 3. Are all
I would have to check at the office just to make sure.
And are you not investigating sources anymore? I know you previously said at some point source investigation is just going to go away because it's just going to be overwhelming. Are you still looking to find sources of where the transmission is occurring?
Yes, that's part of the contact investigation.
Thanks, everyone. We're going to wrap it up there.
Thank you.
Appreciate it very much. More to come this weekend. Thank you.
Will you be doing this tomorrow?
No, we're not going to do it live tomorrow. We're going to be working, but we'll send out a press release with some additional updates, but we're not going to be,
You're not gonna be here.
probably similar time.
Similar time, about 3 hours after that.
Okay.